Well, it has been 9 days since a 31-year-old doctor was raped and murdered, and her body was discovered on the third floor of the seminar hall at the Arjikar Medical College and Hospital in Kolkata. The victim was bleeding from her private parts. Both her eyes and mouth were bleeding as well. Injury marks were found all over her body, including her lips, her nose, her left leg, her lower jaw, and the victim's legs were reportedly 90 degrees apart. This has sparked considerable furor and anger, and the doctors have been protesting for days at the end, calling for justice and a fair probe. As a CBI investigation into the matter is underway, the Indian Medical Association has declared a nationwide 24-hour strike with OPDs shutting down. From Jammu to Thiruvananthapuram and Rajkot to Guwahati, doctors have made their demands clear. They are demanding for hospitals to be declared safe zones with mandatory security cover and police camps on site. They have stressed on the need to install CCTVs in vulnerable areas. Last but not the least, doctors have appealed to the centre to bring a nationwide law to protect them as well. Now, the union government has formed a panel to suggest measures for ensuring healthcare professionals some sort of safety. Our doctors work day in and day out to save the lives of millions of people every day. And the 31-year-old woman doctor who was subjected to brutal torture before being killed worked a 36-hour shift that day. She was saving lives before hers was cruelly and brutally taken away. We need women doctors to be safe in India, and it is time to act rather than point fingers or make empty promises. And that's exactly what we're going to discuss in the next half an hour with our guest. Padma Shri Dr. Sanjeev Bagai, Chairman of Nephron Clinic, joins us on the show. Dr. Ashim Mete, Consultant Senior Pediatrician, also with us on the show. Dr. Ranjan Yadav, AIIMS Delhi Senior Resident, with us on the program as well. Dr. Bagai, we've spoken about this in the past as well. Obviously, it's a travesty what has happened, and the other inconvenience that is ongoing at this point in time, sir, is that the doctors and the associations have decided not to cater to patients, and we have seen that monkeypox cases and dengue cases and malaria cases are on the rise as well. What do you make of this entire situation? Obviously, for the government to enact any kind of a change in terms of the protection of medical professionals, it will take time, but we cannot lose lives in the midst when this is being sorted out. Your take, sir.
Good evening. I think it's extremely distressing. I think the entire nation mourns the loss of their daughter. It's not only their family's loss, it's India's loss, it's the medical fraternity's loss. Protection for healthcare professionals, especially the young residents and the nursing staff in the wee hours of the morning, and for that matter, even during the day, is of paramount importance. It's mandatory. It's a given. And I think the hospital has erred on various levels completely. Apart from that, the law enforcement agencies in West Bengal and the Chief Minister's attitude of what has been happening now leaves a lot to be desired. I don't think they've done themselves any favor. It's good that the CBI has come in, but at the present moment, the Indian Medical Association and the doctor fraternity are very apprehensive. Why would someone send their young daughter for a night duty for over 24 hours with no safety protocols in place? I think it's important that the doctors at all levels get adequate protection. More than 75% of Indian doctors at some point of time in their working career have been harassed or abused or physically assaulted. That's completely unacceptable. We need a very strong law. Yes, it will take time, but I think the central government should come out with a written assurance. They should assure the Indian Medical Association and all the doctors. There should be a public awareness campaign to sensitize the society at large. This is a reflection of the society. And last but not the least, I must add that this animal who was ravaging this young girl in 2 o'clock or 3 o'clock or 4 o'clock in the morning, alone or with other people along. The fact is, why was this person given access? So obviously there is some amount of protection and collude between him and the local police. He had that sticker on of the Calcutta police and the local administration of the hospital. So I think the truth needs to come out. The investigation should be fast. That will satisfy the doctors, and strictest punishment under law. I think this deserves the maximum punishment which is admissible under law. And I think the doctors need to be satisfied that yes, when they go for duty, they are not going to get beaten up and young girls are not going to get raped or murdered. It's a very tricky situation. It's a fine balance. We don't want patients to suffer. We have trained for over for 15 years and practiced for more than 4 decades is to serve patients, but definitely not to get beaten up. And our young doctors, especially the women and the young ladies, cannot be ravaged in this manner. It's so sad. It's really disheartening. Over to you.
You're absolutely right. Let me also, in fact, rope in Dr. Ashim Mete into this conversation. Dr. Ashim Mete, if you can hear me.
Yeah.
All right. Your perception of what's going on over here. Where does this lead to? Where does this end?
Actually, I'm just briefing the events. As you know, every Indians, not only the India, but every part of the world is some sort of aware of this mishap and but regarding the safety and the security of the hospitals, general government hospitals are very unfortunate and vague, because in past few years of my practice, I also faced some very awkward situations where the doctors are working in very insecurely. Not only the fourth class staffs, but the local administration of the hospitals are not responsible here in this part of the world. That is in Kolkata. The several doctors have been brutally beaten by the patient parties due to they are blaming that due to inadequate cares and the treatment from the hospitals, from the doctors, and nobody came into rescue, even the administration or by the present and the past government also. So there is actually several times the doctors, the junior and the senior doctors, are heckled in the field also without any proper response and security from the part of the management of the hospitals and the local police stations and the ministry as well. As you know, this our CM Mamata Banerjee is the minister of police and police and the health minister and everything. She is chief of all, but in spite of that, the initial investigations were very unfortunate. The police commissioner Binit Goel was first step was very wrong, and it was very slow process. They were trying to destroy the bodies without any postmortem initially, and they wrongly informed the parents. Very unfortunately, informed the parents that she has committed suicide, which is very unfortunate. Followed by the attitude of the local police and the police stations and the local OC, and followed by the police commissioners and all the police groups. Not only that, after that incident on 14th of August midnight, where all the females were in the road due to road show and all in protection against this brutal and this mishap, or this the parents, the parent of the victims, as you know, the Tilottama, they are in despair. In spite of that, our CM just offered 10 lakhs rupees as a compensation, and the superintendent and the medical superintendent and the principal were not in the seat, and they not only that they have not complained to the come to the local police stations and lodged any FIR against these incidents. Total administration is unfortunate, and there is still date is they were trying to, the hospital administration were trying to destroy the crime scene. Not only that, unfortunately they repeatedly or on a certain at the midst of night at 12 o'clock on the 14th August, they were trying to destroy the residual crime scene, so that the investigations by the CBI will without any conclusions, and for this reason they are taking a lot of time. And as you know, this part of the world, that is in Kolkata, West Bengal, there is a lot of epidemics of dengue, malaria, and also followed by the hand foot mouth disease by Coxsackie A16 virus. Those who are prevailing in amongst not only the children but also the some sort of adolescents also. This creating a very dreadful situations if this type of strike is being continuous, and there is no satisfactory response for the government, the CM, and the health department as well. Not only that, those who are protesting against this against this event, they have taken very brutal and very cruel decisions regarding transferring the health workers, those who are protesting, to the different states. So in spite of they are standing aside the young students, those who are the future of the nation, the future of the doctors, the junior doctors. They are very apprehended about the activities of the police, and there is no protection from the police, no assurance from the police, no assurance from the chief minister. Totally, as I think there is a chaos, and a lot of medias are there. In spite of that, they are highlighting, they're trying to highlighting, but CBI, they are frantically doing their effort to find out the group of people. As you know, the so-called Sanjay Rai, who is nothing but a just civic volunteers, who was fully drunken on the day. He was just sleeping on in downstairs. He just brought to the place after the events, and he was just showing as the victimized, and no satisfactory result yet has been given, and no cooperations, not sufficient cooperation from the Kolkata police and the police commissioner as well. For this reason, the CBI teams, the expert teams, are facing very difficulty. They are asking the principal, Mr. Sandeep Ghosh, who is full of corruptions and lot of allegations of corruptions against them. In spite of the administration here in this part of the world, there is West Bengal, there is a lot of chaos, as you know. In past 1 or 2 years, a lot of rapes there, the gang rapes, and the rapist and actually the miscreants has not yet get sufficient punishment.
All right, let me also rope in Saira Shah Halim, women activist, into this conversation as well. Saira, if you're there with us.
I beg your pardon?
Saira, if you're there with us. Saira, if you can hear me. Okay, perhaps not. Dr. Ranjan Yadav.
I'm there. I was on mute. Now I'm unmuted. Can you hear me?
I can hear you now. Saira,
Yeah.
unfortunate what's happened here, but there is obviously a lot of politicization going on. But this has opened a Pandora's box of what women's safety is all about. Not only for the vulnerable and the marginalized on the streets, but also women's safety when it comes to for people who are taking care of the ailing and the people who are ill. What kind of a situation do you think that is, and what is the recourse here? Without getting into what should the centre do and what should the state do?
See, firstly, a lot of things have come to light, especially after the NCW has taken over. Because firstly, the cream of the scene of the crime. The question is, why wasn't it sealed by the Kolkata police? And if you look at, now they've taken suo motu cognizance of this entire case. A lot of things are coming in the public domain which weren't there earlier. If you look at, the SOPs that need to be followed, why is this sudden urgency to renovate the place like 50 meters away? Sorry, not 50 meters away, like a little away from the scene of the crime. Why would you want to renovate it? Shouldn't that whole area be sealed immediately? Now, also, if you see that, there has been, it looks as if there's been tampering with evidence. Right now, this entire incident has shocked the nation. Doctors are on strike. My husband is a doctor himself. He was, out in the evening protesting against this very, very absolutely abysmal state of affairs. And you look at the whole shoddy way the principal was transferred and given a plump, posting. Now, if you look at RG, we've seen this whole group in hundreds, miscreants who attacked the doctors. I received WhatsApps from doctors, a lot of forwards that they are being attacked. It could be a last night. So there is something that is definitely not meeting the eye. And, these protests will not stop till we do not get, a satisfactory answer, because all said and done, the poor parents will not get their daughter back. It takes so much. It takes so much of energy, effort, money to educate a girl child and make her, make her become a doctor. And then she meets this very sorry end. I think the women are appalled. The men are equally appalled. The doctors are not resting. Now this has become like a pan-India movement. People are protesting against this globally, and we want to find answers. Then I think the worst part is when our CM, instead of answering tough questions, she takes out another rally. I mean, what are you protesting against, ma'am? You're protesting against your own government. You're protesting against, a key person who is the principal of, Archikar Hospital. I mean, you're protesting against your own governance, and it is shameful, the kind of statements that have come in, that it could be, some CPM members or another political party's members or whatever it is. The fact is that people are angry. And you need to resolve this issue. You need to give us a satisfactory answer. If you look at all the women MPs of Trinamool Congress, and Trinamool Congress sent the largest number of women MPs to the parliament, all of them kept a very studied silence all these days. Now suddenly, it's like as if the Lapata ladies, came back yesterday by joining, I don't know what kind of protest, because she's the CM. She needs to remember that there is a certain respectability of the chair. You cannot behave like an opposition leader. When we saw her squatting outside Singur, or when she was agitating against the previous government, she is the CM now. And what are you agitating against? What are the parliamentarians agitating against? Are you trying to hide away from the people? Are you scared to give us the answers? Because all of us are not going to rest till we get answers. A bright young lady, 31 years of age, has lost her life. The entire hospital, is a big question mark. The way it was running, I've heard there were a lot of illegal rackets also running. So a lot of things are going to get unearthed, and I request the CBI to, give us the correct closure to this issue. And we need to create safer spaces for women, especially when they go out to work. And I hope this gives impetus to other state governments and the central government to frame stricter laws to ensure safety and security of all women in India.
All right, good points there, Saira. Dr. Ranjan Yadav, AIIMS Delhi senior resident, also with us on the show. Dr. Ranjan Yadav, it's unfair. It's unfair what has happened, but at the same time, solutions have to come from both the communities, the government as well as the doctors. Dr. Ranjan Yadav. Okay, perhaps he can't hear me. Okay, let me in fact also open Dr. Datta into this conversation. Dr. Datta.
Hi.
Hi.
Hello.
Well, like I said, same question for you. Well, there are solutions that are anticipated, but they have to come from both the sides, the doctors and the government. Where do you stand on that?
Can you repeat? I didn't get your question.
Well, I'm saying that solutions have to come forth now, and solutions have to come from the government as well as the medical community. But at this point in time, there seems to be a stalemate of sorts between both. What's the way out?
Right. So I think we all discussed regarding how gruesome the act was, and the doctors are on protest all across the country. I would like to let you know that we are here right now at Jantar Mantar protesting for justice for our colleague, as well as for a Central Protection Act to ensure that such a heinous crime does not happen once again. Why we need this crime right now is because at one point of time, what happened in Archikar Medical College is absolutely brutal and gruesome. Secondly, this can happen in any college across the country, even in cities. This happened in Kolkata, it can happen in any city, or even in the rural setups where there is absolutely no security. So what we right now want is a safe space to work in, so that when we go to work every day, we don't have to think about our security and safety, and we can just think about serving our patients. This is the reason why all across the country, more than 2 lakh doctors are on the road right now, and we are protesting in one uniform demand, that is Central Protection Act. Right now, we have had our multiple meetings with the different RDAs and resident doctor associations representing over 2 lakh resident doctors of the country, and we have decided that we will have only one demand, that we want an ordinance from the central government to bring in an act which can protect all healthcare professionals and hospital premises.
All right, let me get a response from Dr. Bagai on what you've said. Dr. Bagai, is an ordinance going to be enough in such a scenario?
So I think there are 3 different levels which I will approach this. One is, and it's extremely important, it's a reflection of the society. I think we need to sensitize the society, however long it takes and however tough it may be. I think we need to sensitize the society. Point number two, we need exemplary punishment. Let this be a deterrent for anyone who behaves in this manner, in a savage manner, who's ravaged this young girl, that no one should even ever dream of doing such a thing. And point number three is we need an act, but more importantly, we need the hospitals surveyed on a regular basis where the checks and balances are put in place. So we need access cards, we need digital monitoring, we need CCTV cameras, we need female guards, we need male guards, we need given number of a control room. There are various levels of which are implementable. This rascal should not be entering the hospital with no denied access everywhere and anywhere at 2 o'clock, 3 o'clock early morning. That's a cause of worry. I don't think the doctors' demands are unjust. It is absolutely justified. I would request that the process be started soon. Finish this investigation fast-tracked so that people know that justice is there. Let it be named and shamed. Let this person get the maximum punishment. But don't let any other guilty who are hiding behind him escape without being punished adequately. There are other people involved in this too.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.